to discuss the implications, some of the implications, the one that has come to my head, some of the implications of this suspension. Hi, welcome back to my YouTube channel. It's me again, Chisom, and welcome to Sumi Space. So this time around, I'll be talking on health. You heard me, health. So I'm a pharmacist by profession, and I want to discuss. We recently heard that to discuss the implications, some of the implications, the one that has come to my head, some of the implications of this suspension. Then Trump suspended funding for foreign aid. So as a healthcare professional working in HIV program, I'd like, number one, if care is not taken, there will be what? Scarcity of commodity. Remember, HIV medication is a very expensive drug and has been shared or has been distributed free of charge throughout this whole period of the program. So what it means is that the drugs will not be available. People will start buying the drugs. You can get 1 month's drug, 1 month, for like 30,000 naira for one. Okay, this is one, not the complete regimen. For example, if you're taking of course, HIV is a combination drug. You don't use a single dose, a single therapy. So if you use for one of the combinations, you can get it for like 30,000 naira. That is very, very second line drug. I don't want to use some serious terminologies. So let's say on the average, the person can be spending let's just say 30,000 naira per month. And it's as if, when you look at it, those in the village have not eaten. They've not eaten, and you want them to buy a drug of 30,000 naira. What does that mean? There will be increased rate of transmission. Infection rates will increase. Incidence of HIV will definitely increase. That's the transmission rate. You have new infections, plenty new infections. Reason is because those that are taking the drugs that cannot afford the drugs any longer, their viral load will increase. And when it increases, what does it mean? It means that the rate of transmission of the virus is higher, so they will transmit there will be easier transmission. 2, discordant couples. Of course, you know what I mean by discordant couples that the wife is positive and the husband is negative. They try to suppress the viral load of the person that is positive to reduce the transmission rate. Of course, they can't meet again unless they put in some other precautionary measures. 3, if the viral load of the virus is high in your system, it gives room for other infections to fly. So you might be thinking, it's not only me, I'm not HIV positive, therefore I don't need it, it won't affect me. It will affect you. How? 1, if the person that has HIV gets tuberculosis, let's say he gets tuberculosis like this. Tuberculosis, it doesn't really have, you don't need to have HIV to have tuberculosis. Hope you know. So the rate of transmission of tuberculosis will be high. People will have tuberculosis because they have people in their homes that are spreading it, in the market spreading it. You go to markets now. So don't think like it will not affect you because you don't have HIV. Somehow it will affect you. 3, resistance. HIV drug is not the ARV drug, it's not the drug you start and you stop. So that is why before you commence ARV treatment, you are cancelled. You go through counseling to explain to you that you don't start and stop. This is the reason, because of drug resistance. Because it takes a whole lot. It took a whole lot to produce those drugs. And whenever you develop resistance to the first line drug, you enter second line drug. If you develop resistance to second line drug, third line drug, If the third line drug is not working for you, then I don't know. However, remember we said that we're going to be buying those drugs. First line drug is expensive. Second line is more expensive. Then the third line is the most expensive. So I don't know how we're going to do this. I really don't know how we're going to do this, because everybody is involved. So if you're not, don't say I don't have HIV. Let it not come out of your mouth. Everybody is involved. So if you're right now, let me just try to, if you have a brother or a sister or a husband or a fiance, anybody that is in government, they need to close this gap. This is the gap I'm sure you don't want to experience. This is a gap you don't want to experience, trust me. Because do you know the number of people that will die? You know, when they say HIV, you think people don't have HIV. As somebody that is working in HIV program, plenty people have this disease. Plenty. And reading the blog, and I saw different people saying use a condom. How is it? It's their fault. Why didn't they use a condom? HIV is not transmitted only through sexual intercourse. Some people get HIV from birth. It was not their fault. It's not their fault that they have this disease. So imagine those people now suffering for what they didn't do. Now they don't have these drugs available to them, and they didn't sleep with anybody. These people, you have young children that are HIV positive, from mother to infant. You have newborn people that are newborn that take oral suspension to prevent them from having this infection. Right now, if the drug is scarce, the parents will be able to give them, and these drugs are important within the first 72 hours of birth. Should be commenced within the first 72 hours of birth. And if this is missed, the tendency of them having HIV, it's high. So if you have anybody in government, if you're related to any person in government, please, I'm sure this is not a gap we would like to see. So I advise you, please, talk to them. Let them start up. Let them ensure that the drugs are being taken to the hospital. Let them ensure that they bring in, I read on that they bring in these commodities for patients, or even subsidize, sorry about that, or even subsidize the amounts for these patients. My dear, the way I'm thinking about it, it's something that I don't even want to see. I don't want to see it. I don't want to see the effect. So let's just try and do something about it. Please, if you need any government official, please tag the person to this post. See you later. Remember, like, subscribe, and share. Bye.